So very good afternoon to all of you. I will be presenting a novel technique for repair of large cyclodialysis clefts. Cyclodialysis clefts are defined as the separation of the ciliary body from the sclera secondary to blunt trauma or as a complication of surgical intervention very commonly encountered after glaucoma surgeries. The extent of the clefts may vary, causing persistent hypotony in the patients. Various techniques have been described for the management of these clefts, such as cryopexy, encircling bands, suturing the cleft, etc. However, there is a paucity of techniques described in literature for the management of large clefts which are more than 180 degrees in extent. So my study was to evaluate the efficacy and complications of a novel technique described as sewing machine technique for the management of large cyclodialysis clefts, and also to evaluate the visual improvement after the cleft repair. This was a retrospective study where all the patients diagnosed with large cyclodialysis clefts from Jan 2017 to January 22 were included, and the demographic profile of these patients was recorded, and the large cleft was defined as more than 180 degrees in extent on gonioscopy and confirmed on doing a UBM. These were my inclusion and exclusion criteria, and I will just show a short video. Can I have the voice, please? So this was a 14-year-old boy who presented with diminution of vision in the right eye with a history of blunt trauma with a badminton racket 4 months back. He had a subluxated lens. I still don't have the voiceover, please.
Here's how a sewing machine works. There's a threaded needle above the fabric. When it pierces the fabric, a rotating shuttle hook below catches the thread.
We present the sewing machine technique to repair a cyclodialysis cleft. Lensectomy and vitrectomy was done, followed by intraophthalmoscopy to confirm the extent of the cleft. A scleral plug was made and 10-0 proline suture was threaded into a 26-gauge needle. And the needle was cut off. The needle with proline suture was passed through the cleft, and a loop was taken out, which was kept in place with the help of a 30-gauge needle. This was repeated multiple times, and multiple loops were taken out, which were kept in place with the help of the 30-gauge needle. The 30-gauge needle was extended to keep all the loops in place, and the suture was finally pulled out. And the tenoproline suture was then passed through all the loops. The 30-gauge needle was removed and the suture was tightened. This was repeated on the other side as well. So after doing this, a post-operative follow-up at 12 weeks, the IOP had increased to 18 mm of Hg, and this patient underwent a secondary IOL implantation at 6 months follow-up and recovered a vision of 6/9 with an IOP of 18 millimeters of mercury. And you can appreciate the extensive scarring secondary to the blunt trauma. Till now, we have repaired 5 cases in a similar way, And the average IOP at the presentation was 3.4 mm Hg, and the average follow-up time was about a year. And the IOP post-operatively, average IOP was 10 millimeters of mercury, and no post-op complications were noted. The etiology of the cleft was blunt trauma in 4 cases and post-trab in 1 case. Therefore, to conclude, large clefts are more than 180 degrees in extent and they are difficult to treat. Sewing machine technique to repair the large cyclodialysis clefts offers a treatment option to manage these difficult to treat large clefts with no post-operative complications. However, a further confirmation of the efficacy of this technique may require a larger number of patients managed by this technique through a prospective multicentric study. These are my references. Thank you for patient listening.
So just a small question I would like to ask. Like, you're using the 30 gauge needle to hold the sutures outside.
I mean, you can use any needle. That is basically to just keep the loops in place so that they don't go back inside the eye.
I think, won't you think that a blunt instrument will be a better thing?
Yes, you can use that. Absolutely. Anything which doesn't allow the loops to go back into the eye again.
What are the complications you encountered? Any bleeding, vitreous bleeding or some?
Very minimal bleeding can happen because it's a little blind procedure that you are putting the needle, but that clears up in about a week's time. But I have not had a major bleed which required another surgical intervention.
Any retinal tear or
No,
retinal
no.
detachment?
This is too anterior. It's 1.5 mm behind the limbus.
So you have no inadvertent injury to the retina?
No, no, not at all.
Any post-traumatic retinal tear which was there, which may have exaggerated following the surgical intervention?
Not really, because we thoroughly examine the retina before taking up these patients for any surgery because they are post-trauma cases. So we know they are prone to develop dialysis or tears. So we take care of that before planning the surgical intervention.
And you closed it under saline or air, ma'am?
I close it under saline, yes. Because we are already dealing with eyes with hypotony, so air would not be a good option for them.
Thank you.
Thank you so much.